Receiving a call back after a mammogram can certainly create a knot of anxiety in your stomach, leaving you wondering about what comes next. It is completely normal to feel this way, especially when the results are not a clear all clear. No, an inconclusive mammogram is generally not considered a false positive. Instead, it means that the imaging did not provide enough clear information for the radiologist to make a definitive assessment, requiring further investigation to get a clearer picture. There are several very common reasons why a mammogram might be inconclusive. One frequent factor is dense breast tissue, which can obscure potential abnormalities and make them harder to see on the imaging. Sometimes, normal overlapping breast tissue can also mimic an area of concern, or there might be benign calcifications or cysts that simply need a closer look. A mammogram is primarily a screening tool designed to flag anything that warrants additional attention, not necessarily to provide a final diagnosis. So, what happens if your mammogram is inconclusive? Typically, your doctor will recommend additional imaging, such as a diagnostic mammogram, which takes more detailed or magnified views of the area in question. An ultrasound might also be used to distinguish between solid masses and fluid-filled cysts. In some cases, a breast magnetic resonance imaging, or MRI, could be suggested to provide even more comprehensive views. These follow-up tests are crucial steps to gain more clarity and are part of a thorough evaluation. Understanding the difference between a screening mammogram and a diagnostic mammogram is key here. A screening mammogram is like a wide-angle snapshot, while a diagnostic mammogram offers a zoom-in to focus on specific areas with greater detail. This precise follow-up helps to either confirm a benign finding or identify a potential concern early, allowing for timely action. It is all about obtaining the clearest possible image to ensure nothing is missed. Ultimately, an inconclusive mammogram is not a diagnosis of breast cancer, nor is it necessarily a false alarm. It is a stepping stone in the diagnostic process, guiding healthcare professionals to gather more information. Taking these next steps calmly and proactively is an excellent way to gain clarity and ensure your breast health is thoroughly evaluated, moving you closer to peace of mind.